Thank you. Thank you, everybody, for coming today. Well, it is my great honor to introduce James Blessman. He is a native Detroiter and a product of the Detroit Public Schools. And I've gotten to know James recently as he's joined the Cures. He's been with Wayne State University in the field of occupational medicine for over 25 years. He's a faculty member, and he's quite dynamic and very fun to listen to, so I'm very pleased to be able to introduce him. He has served in many capacities, including both medical director for risk management for the City of Detroit, as well as the medical officer for the City of Detroit Health Department. So he is currently serves as the Cures Community Outreach and Engagement Core Co-Director. So those are really long titles, and so all these university long titles tend to get shortened into acronyms. So if you hear the word COEC, that's what that stands for, Community Outreach and Engagement Core. So he's the Cures COEC Co-Director. His main interest is in the area of social fitness and its role in the development of healthy behaviors, and for this reason, you will usually see him with his hat as it carries his mission and his vision. So read the front of his hat. It's always dedicated to what he's working on currently. So it's my great pleasure to introduce James Blessman. Thank you.
Good morning. Good morning. Glad to be here. Thank you for commenting on my hat. Some people think I wear this to be cool. I am cool, but that's not why I wear the hat. And we won't really talk about that. So really great to be here. Let me just mention, because we don't have a lot of time, but this effort is really part of a $100 million investment by Wayne State University to better link environmental health researchers to the community itself, because it's trying to address health disparities. And the director for this effort, so there's this iBio building that was created to bring all the researchers together to improve their ability to have discussions together, as well as not only with Wayne State, but with other universities as well. And so one of the things we do is we have these symposiums to have discussions amongst the researchers, and then this is considered to be a chat where we take that type of information and distill it down for the community. It's a little bit of a challenge to kind of take several discussions from researchers where they're already complaining about only having a certain amount of time to have their discussion, and then I got to take that and put that into 15 minutes or so. So I hope to do them justice. We do have some Cures members here also, and hopefully you'll get a chance to meet some of them. So we had, on October 7th, there was a discussion on new perspectives in allergy and asthma, and described it as an epidemic, what it apparently does seem to be. And we had 7 speakers. So the first was a Dennis Ownby from Georgia Regents University. And what was interesting about his discussion to me is that the whole issue or challenge with allergy and asthma really seems to be a phenomena of the 70s and 80s. So if you look at the turn of the century, where there might have been some allergy there, it was kind of bubbling along, maybe somewhere around 1% or so, somewhere around the 70s and 80s, there was this marked rise in challenges with allergies, now up to around 50%, and with asthma, where in some communities and some groups, it can be as high as 30. That's like a 30-fold increase. And the other thing that's interesting about that is it seemed to happen everywhere, like the world at once, all different countries, and I'm going to say more developed countries. So in the developed countries, there was this rise in asthma and allergy at the same time, which is just very interesting. So what it does suggest is that there's something that we did collectively that seems to be impacting our health, okay, around the 70s or 80s. And I do have my theories, but I'm going to hold those to myself for right now. But if I'm pressed, I'll mention it. There are some other risk factors that seem to be important. Those who are below the poverty line seem to have more difficulty. Those who are obese seem to have more difficulty. It seems to be markedly increased in the African American community. And what's interesting is that we seem to have a ton of it around Detroit, okay? Just a lot of it. And, but the good news is there has been some success. Like if you look at with latex allergy, which seemed to go up, we did identify that, and then things went down. So that was one. Then it was followed by Kathleen Sloninger, who is here this morning, is a nurse, and she's going to speak, and just kind of, again, impressed me with the fact that it is very prevalent, about 1 million people in Michigan having difficulty. But the important point to her talk to me was that we don't seem to be implementing best practices, both from the standpoint of treatment of medication, evaluating our environments for triggers and that type of thing, which means that we could do a lot better for those who are currently having difficulty if we would just do the things that we know are right, which is really my interest area, because I've come to find that knowledge of the right road doesn't ensure the right road will be taken. And I'm very interested in what that's about, and that's why I'm interested in the social fitness thing. It's almost like, in a way, people come to the fork in the road and they know that they should go right and they go left, kind of looking at the right side going, man, I'm supposed to be over there. It's almost like we become addicted to misery in some way. So, and that's really what I'm interested in. But again, I can't tell you about that right now. So, because this is about the other thing, not my stuff. So in any event, then we had John Cambier who came in, and he made mention, he does like immunology processes, and really pointed out that it's kind of a two-stage process. So you have an exposure, it goes to a particular cell, that cell kind of hands off that information to, there's this, what they call a dendritic cell, to a T lymphocyte, that's a little complicated, that hands it off to a B lymphocyte, which then makes this IgE antibody, and then when you're exposed again to that substance and it interacts with this IgE antibody, it causes this rapid response of sneezing and shortness of breath and all that type of thing. The interesting thing about it is that we're realizing that while there is that one pathway, there also does seem to be another pathway that doesn't necessarily involve those cells. So chemicals and even down to gases can kind of do the same thing, which involves a certain amount of learning. Right? So you have this exposure, and then these cells kind of communicate with each other, and the way that they communicate by, excreting certain factors and whatnot may speak to our own genetics, because our cells have how they know how to communicate. Just like, there are certain networks of people where rumors might spread a little faster than others. Right? I mean, it's almost the same type thing. So when you're exposed to something that you've been exposed to before, then that's why you have a problem. And the importance of that is a lot of times when people have difficulty, they're looking for something new. And it may not necessarily be something new because it's something that you had to have been exposed to before, okay? The other important part about that is that because there's several things that along the way that go wrong, usually we see in occupational medicine that when there's a problem, it usually is not one thing, one failure. There's usually several failures along the way. And so you have to begin to understand that particular pathway. And so we had another researcher who came and really validated that, talking about issues of ozone, that ozone as a gas seems to actually, even more than an irritant, seems to be able to cause asthma itself. Again, as a chemical can do that. So this whole thing about being careful of these ozone action days, people want to go out, and get all that sun at the hottest point of the day. It may not be a good idea. I'm just saying, okay? So, and then that moved to a very interesting discussion by Larry Lemke, who is, he's at Wayne State University, and he was doing work on looking at, he took like 100 monitors and placed them all over the city and Windsor. And his idea was to understand the relationship between outdoor pollution and asthma, kind of exacerbations, people going to the hospital, emergency room, and that type of thing. So he had all these monitors going around, and he measured some around 50 or so pollutants, all right? Now, what was interesting about his study, kind of some major findings. First of all, it does vary across the city, okay, and Windsor, and there's this variance over time in terms of what people are exposed to and that type of thing. And he could show a relationship between high levels and increased exacerbations, people going to the emergency. So high level of pollutants, people going. But there's a lot of scatter. And by that I mean, sometimes you have high exposures, pollutants, and people are not going to the emergency room, all right? They don't go to the emergency room. Or you can have low exposures and people are going to the emergency room. So the point is, it's more than just outdoor issues that are important, okay? No, I mean, just really. So we may think about that, but again, there are some issues, some other issues besides that seem to be playing a role. And then we went from that to, let me see, I think it was Jack, no, we talked about Jack Harkema already, because he was the one who did the ozone, and then Larry Lemke, who did the monitoring. And then we get to Dr. Christine Cole-Johnson, who, and she's going to be speaking today, so I don't want to steal her fire. But I'm not going to steal fire. But part of the challenge may be that we're too clean. All right, and so you'll hear a little bit about the hygiene hypothesis. And then it ended with a gentleman, Nicholas Lukács, who also, along that line, was looking at the role of bacteria and noting that bacteria, there's certain bacteria that are friendly that actually do produce substances that seem to benefit us. And the point that really hit me was your body is kind of like your own earth. And you can do things that disturb that balance, and as a consequence of that disturbance, there could be a fair amount of suffering. So we just want to pay attention to that. So it ended with, first of all, I thought it was very good, where, again, there seems to be a lot of disease, particularly around here. I would say that I was very impressed that there are some really smart people trying to resolve this particular challenge. But I think that we have to help them help us do better. And the way that we do that is by educating yourself about the mechanisms, becoming very aware of your behaviors and your experiences and your exposures and the relationship between that and various things that you experience. And the more we have that particular dialogue about those observations, the better we can do about figuring out how do we resolve them. And we gotta do it because as one rise, we all rise, right? And we don't want anybody to be ill. There were hands raised about the number of people who had difficulty with asthma, who had known going to the hospital. It is it is a heavy burden on our spirit to see someone who has difficulty breathing. So this is something that we have to rally around. Because there's so much around here, the better communication we have, we may be able to fix this, and then we become the tip of the spear that may help the rest of the country and the world, okay? Thank you very much.
Thank you.
Test.
Thank you, Dr. Blessman.